That's great. I love that advice to kind of have alternative methods, right? I came from engineering. They always said, always have redundancy in the system, right? And so
Right.
you dealing with one clearinghouse, make sure you have another one or you have access to the claims in case things like this happen. It's always good to have redundancy. So, I think the challenge, I've seen, we work with a lot of independent physician groups. Obviously, the big groups, they can handle the financial, load. They probably have some money in the bank, but it's really struggle for those independent physician organizations, right? Those who have fewer than 10 physicians. I think the American Medical Association did a survey of about 1,400 physicians out there, and they said this cyber attack really hurt them. They said 80% from this informal survey had lost revenue from unpaid claims. They said 55% of respondents had to use personal funds to cover practice expenses. Some of the anecdotal information is that this cyber attack may bankrupt our practice of 50 years in this rural community. It says our payroll taxes and gross receipts are not able to be paid, resulting in penalties. It says we are barely able to pay employees and can't pay our vendors. They just didn't have the bankroll to handle this attack. And so you're wondering if this is going to put even more pressure. I think this is a statistic said for after the pandemic, for the first time, independent physicians are below 50%. Most physicians were kind of like independent, right? Did their own thing. But now, with the pandemic, and burnout, they started to get acquired by hospital systems and private equity firms. Now this is just further pressuring a lot of these independent physicians to say, you know what, I think I want to get out of this. And so, what is your advice to them as they're kind of figuring out how to get through this process and kind of get on the other end so they can get their practice in a better path?
The fix isn't more automation. It's keeping patients engaged with a human in the loop. That's exactly what we built for. As a matter of fact, that human to human connection is so important to us here at SynsorMed that we created a new AI tool called Simon. It's about getting patients engaged in their own care while keeping the human in the loop. A reward-based system that gets them taking their meds, checking their blood pressure, and staying active, all in a point system with leaderboards to keep them excited about their healthcare journey. It really keeps the patient and the human in the middle, but uses AI to track everything and encourage patients along the way. Hey, if you want to see it, if it fits your organization, click the link below, check it out, and give us a call if it makes sense.